Hi. A young and aspiring physiotherapist always wants to help and heal his patients quickly, but this doesn't happen as planned. This is because the patients usually don't understand what the physiotherapist is trying to convey them. Why is there a gap in understanding? How do we ensure patients understand what we say? This video is going to be about that. A key factor for delivering a good service is good and effective communication. Physiotherapists communicate with their patients every day, but do they communicate effectively? Here's how you improve your communication to be more effective. 1. Listen more. Listen more at the start of a conversation. The more we listen, the more we get to know about the patient and condition. Give patients more time to speak, as they may speak slowly due to their age, illness, or cognitive difficulties. This will make the patients feel more valued. Give confidence to patient that you are listening with gentle head nodding and by using appropriate simple words like okay. When the patient has finished speaking, echo back to him or her what you have understood. Listening also includes listening to complaints or unhappiness about the treatment. Modifications made according to complaints gives the patients confidence to be part of the rehab. 2. Be careful with your language. Good verbal communication is important for developing a good rapport with the patient. Ensure that you follow the 7 C's: clear, concise, concrete, correct, coherent, complete and courteous, during any communication. Make the interaction easier for patients by avoiding medical terminologies and by using words which are easily understandable by the patient. Be respectful, encouraging and positive. The tone of your voice is also important, as patient may feel uncomfortable with an irritated or impatient tone. 3. Present a confident body language. Your body language sends signals to patients continuously, like the way your face looks, or how you move, or how you position your body. Make good eye contact with the patient and make positive gestures like head nodding or smiling to keep patient engaged in the conversation. Feel confident in your posture. Facial expression and touch must match with the words you say. Remember, an inappropriate body language could send wrong message to the patient and thereby break the patient's trust. 4. Ask questions appropriately. Questioning needs to be correct in order to generate the correct answers from the patient and help physiotherapists understand the patient's issues and what the patient needs. Questions can be closed questions or open questions. Closed questions need a simple yes or no answer or a confirmation of something. For instance, is it paining? Open questions encourage patients to open up and make the patient to speak in more depth about something. The best example of an open question is, how do you feel? It is always good to start with an open question during the start of the interaction, as it gives chance for the patient to explain more about their complaint. Follow one open question with another one in order to gather more information. 5. Document everything. Document everything from when the patient enters to when the patient leaves. Documentation has to follow the same 7 C's as verbal skills, and physiotherapists should ensure nothing inappropriate is written down. Documentation is important mainly for 1. Recording the treatment that has been given to the patient. 2. Continuity of treatment after a break or if there are more than one therapist attending the same patient. 3. Documented evidence in case of any complaint from a patient about the care they have received. Instructions to patients should also be documented correctly in order for the patients to comply with the rehab protocol. Barriers to communication. Physiotherapists will always come across situations where they will not be able to communicate effectively. These are called barriers and they have very simple solutions. Few examples are: patient can be confused or have memory issues, the environment could be noisy and lacking privacy, patient could speak a different language, or patient could have hearing or speech impairment. All of these can be easily overcome according to the barrier, and is very important to note these barriers. So, let's recap the points for effective communication. Always patient comes first. Listen first and echo patient's words. Don't talk too fast and speak in a simple language. Be wary of your body language. Make sure the patient is engaged through relevant questions. Document and follow through. Find solutions if you hit barriers. And oh wait, always give the patient one last chance to ask you any questions before they leave. Thanks for watching my video. Hope this was helpful to you all. Please subscribe to my channel if you like this video. See you all in my next video. Bye.